Hello, good afternoon. Yes, Alyssa, you all should be on mute that are joining. All right, good afternoon, everyone. Welcome everyone to Indigenous Health Topics. I'm Karina Sabiq. I host Indigenous Health Topics. I'm here with my colleague from Arizona, Trudy. I'm located here in Rochester and really excited for this conversation today. I will be going through a few housekeeping items. So let's go ahead and get started. All right, so we will have time at the end of the presentation for a Q&A. Please add your questions using the Zoom Q&A function that you will see at the bottom of your screen. Let us all strengthen our community. Please introduce yourself in the chat. Let us know where you're from, where you're logging in from. I know we have everyone signed in from across the nation, so it's always good to see where everyone is at and your tribal affiliation as well. So welcome all. I'm going to go ahead and introduce our guest speaker. So Dr. Victoria O'Keefe. She is Associate Director at the Center for Indigenous Health at Johns Hopkins Bloomberg School of Public Health. And today she will be speaking on strengths-based research. So really excited for this topic today. I'm going to go ahead and hand it over to Dr. O'Keefe.
Wando, thanks so much for the invitation and for that introduction. And thanks for everyone who's joining. I'm just going to share my screen and my slides. Okay. So I'm really excited to talk with you all today about uplifting our community and cultural strengths in health research. And just want to start with an introduction and grounding myself in who I am and why I'm involved in this work. I'll also share about the Center for Indigenous Health at Johns Hopkins University, where I'm privileged to work. I'll provide some background information and why we really need Indigenous strengths-based research, alongside two example projects that I've had the pleasure of working with big teams on. One focused on how do we conceptualize, how do we think about Indigenous strengths-based research, and then also another ongoing project where we're developing a survey measure looking at connection across generations. I'll provide some conclusions and then we'll have some time for questions and dialogue together. So just to share a little bit about myself, I'm a citizen of the Cherokee Nation. I'm also a member of the Seminole Nation of Oklahoma. I always like to share that my late grandmother, Virginia Feather Rivas, is a big inspiration of mine, who you see pictured on the bottom left. My grandmother was a community health representative for the Cherokee Nation, and she was a first and fluent language speaker. She was also a basket weaver, a seamstress, a beadworker, among so many other talents that she had. But she really taught me the importance of working with and for our community. When I was getting my PhD, she told me, "You're going to get your degree and then you're going to come home and work for your people." And what she was speaking to were our Cherokee community values that we are responsible for upholding in our daily life. My mom was born and raised on the Cherokee Nation reservation. This is where my mom grew up, right on this creek in Oklahoma. And my dad is from Cleveland, Ohio. And that's where I was actually born and raised. I'm a clinical psychologist by training. I went to Oklahoma State University where I focused on suicide prevention within our Native communities, as well as clinical training. and I joined the Johns Hopkins Center for Indigenous Health in 2017. So the world of public health was very new to me, but I like to think in many ways that was my grandmother's influence for me to jump in the world of public health since she was a public health worker herself. So one of the things that I like to share also about my background is in much of my education, um, and the places that I grew up, we didn't have a lot of topics about our communities, about contemporary issues. When I was an undergraduate, as well as in graduate school, I noticed a lot of academic articles and books were written first by a lot of non-Indigenous people. And on top of that, a lot of them were really focused on risk, on deficits, on disorders. And I didn't see the amazing community and cultural strengths that we know are present in our communities and that my family has passed on to me, represented in research. So that's really been a motivating force for me in my work as well as my personal life, is to contribute to this larger change that we as Indigenous peoples deserve to be in all spaces. This includes academia and research, and to be really working with and for our communities on strengths-based work that reflects our communities. So that's really the focus of this talk today, is really how can we uplift our communities and make sure that our strengths and our cultural strengths are really present and uplifted in our research. So just to tell you a little bit about the Johns Hopkins Center for Indigenous Health, we were founded in 1991 at the Johns Hopkins Bloomberg School of Public Health within the Department of International Health by Dr. Matu Santosham. Dr. Santosham is an infectious disease pediatrician. Prior to founding our center, he established a really close relationship with some communities in the Southwest. And because he had really trusting partnerships with some tribes in the Southwest, that really provided the foundation for our center to grow over the last few decades. So our mission is to work in partnership with communities to advance Indigenous well-being and health leadership to the highest level. And our vision is thriving Indigenous communities worldwide. In terms of the work that we do at the Center for Indigenous Health, we have 4 main cores that guide our work. So we do research and evaluation. All of our work is community engaged or community-based participatory research, in which we partner with communities to develop strengths-based research, addressing public health priorities, and share our solutions with the world. We also have a wise practices core, and what this means is that we don't want research to just be published in academic journals, to not be accessible to communities, to not be used in communities. So we really make sure that tribes and urban Native communities and Indigenous communities are able to take the programs that we know are working with communities and adapt them for their own communities as well. We're also really dedicated to educating and training the next generation of Indigenous public health scholars and public health workers. And then finally, our policy and advocacy core is really working to accelerate equity through policy that can transform access to health and education, as well as uplift tribal sovereignty. So just some key highlights about our Center for Indigenous Health. We have been around for more than 30 years. We currently have collaborations with more than 185 Indigenous communities across 29 states in the US, as well as 4 countries around the world working with Indigenous communities. As I just mentioned, we're also really excited and motivated in terms of education and training. So we have trained nearly 5,000 students, faculty, as well as community mental health community health workers at different stages of their career. And then in terms of our work has impacted millions of people worldwide. So again, some of the public health solutions, some of the programs that we're running have been shared and delivered with folks around the world. Today we have more than 300 faculty and staff working at our center. 80% of our center's employees are Indigenous. Over 90% of our teams are working on the front lines of their own communities. And then this map shows where we have partnerships. So the states that are in teal are where we currently partner with various communities. And then you'll see these symbols with our center logo. This is where we have offices. So I'm located in our Baltimore office on Piscataway and Susquehannock lands. We also have an office near many of you. If you are located in Minnesota, Dr. Melissa Walls, who is Anishinaabe, leads our Great Lakes Hub in Duluth, Minnesota. We also have numerous offices across the Southwest. Again, that really stems from our founding with tribal nations in the Southwest. And then our newest hub is led by Dr. Dawn Warren, who's Oglala Lakota, and that is in Rapid City, South Dakota. So we really value place-based work where the work is really led by, for, and with our communities. Some of the core themes of our work, we work a lot across a lot of different topics, from infectious disease prevention, family-based health promotion and early child development, mental health and adolescent youth development and empowerment, environmental health, training and education, as well as policy. So with that background, I also want to just start to dive into the topic today of strengths-based research and really why we need strengths-based research. So I'm sure many, if not everyone who's attending, understands settler colonialism and systematic policies of genocide and land and cultural dispossession and forced assimilation that have been and continue to be extremely destructive to our Indigenous families and communities' ways of living and being. This includes numerous policies, including the boarding school era, as well as many others. But this, the impacts of these policies continue to be present in many of our communities. And settler colonialism and impacts in these historically traumatic events, as well as broken treaties, continued discrimination, and other social, economic, and political injustices really continue to drive health and mental health inequities that we see in many of our communities today. I won't go through all of the statistics, but you can see numerous disproportionate impacts across mortality, across mental health, across substance use, chronic diseases, as well as education and employment. And so when we think about research today, there is really this undeniable link between Western research as it's known today and colonialism and imperialism. So when we think about the research that many of us are taught in universities, the type of health research that's privileged in academic peer-reviewed publications, there's really a tension between Western research as it's known and the ways that our communities see research. And this information comes from the amazing book, Decolonizing Methodologies by Maori scholar, Dr. Linda Tuhiwai Smith. And she talks about how as Indigenous peoples and lands were colonized, and knowledge and research was also a colonized activity by Europeans. And that type of research and Eurocentric research was built on the foundation of really focused on Western knowledge and methods. So when she talks about the phrase research through imperial eyes, what she means is that there became this way in research that Western ideas or Eurocentric ideas are the only ideas, that Western research is the only research that counts as real or actual research, and that the Western world defines who's a researcher. And so this quickly became a context in action demonstrating othering, where the West or Eurocentric countries are us, and Indigenous peoples became them, and were treated as objects to study, not communities and humans with voice, with autonomy, with self-determination in their own right. So when we think about research today, there are different ways that we can look at research. So again, unfortunately, a lot of institutions continue to really follow a Western paradigm of research. And sometimes that research can be used as a tool of colonialism. However, research is not new to our communities. Our peoples have always been observers and researchers and scientists. Our communities have Indigenous knowledge systems that have provided for us, for our health, for our well-being and life. So how do we move away from the colonial harms of research and towards research as a way of healing, a way of reclamation, and led by, for, and with us? So there's a call and movement by many communities and leaders and healthcare providers and Indigenous scholars to uplift and prioritize approaches that really uplift and strengthen our health, our mental health, and well-being through our cultural strengths. And again, we have knowledge systems, we have values and traditions that have promoted health, well-being, and life for generations. So how do we uplift those knowledges and those strengths within the context of research today? So in terms of Indigenous health research specifically, there's really been this focus on deficit, risk, pathology. When we look at the field of strengths and what do we mean by strengths-based research, we often get definitions from fields like psychology and social work that tend to focus on resilience or positive psychological constructs that really focus on the individual and individual characteristics and experiences that, again, stem from these really Eurocentric epistemologies rather than Indigenous knowledge systems. So how do we move towards indigenizing strengths-based research? There are some Indigenous authors who wrote an academic article about the need to move away from resilience as this individual attribute that's internalized within a person and towards collective and cultural strengths within our communities. So with that background in mind, I want to share just two studies, two projects that I've been working on over the last few years with large teams, both at the Center for Indigenous Health, but teams across the country as well, really engaging community members and Indigenous researchers, really trying to move towards what is indigenizing strengths-based research. So the first study that I want to talk about was really focused on that question. How do we define an Indigenous strengths-based approach to health research? So we took on empowering Indigenous voices to bring forth new conceptions of what strengths-based approaches are to health research and how they're defined. And by coming to a more precise or holistic definition, We hope that this definition can guide Indigenous wellness research. So our research team that led this project was an all Indigenous research team. And we used a methodology called group concept mapping, which is a structured method for organizing ideas on a group, of a group on a topic of interest. So it brings together both qualitative and quantitative data. It's inherently participatory, and I'll go through each of the different phases and you'll see the ways that this type of research is really engaging participants in the whole process. So there are 3 phases to group concept mapping called idea generation, data organizing, and then interpreting the data. And I'll go through for our specific study what this looked like. In terms of our participants and collaborators, we had 27 Indigenous researchers who were proposively invited to participate as well as co-author the paper. We asked the researchers, what areas of health and wellness research do you work in? And you can see the results here. So most researchers reported working in topics focused on mental health, substance use, as well as traditional medicine or traditional healing, but also many other areas. And just to note, the researchers could choose more than one category because many of us and many researchers work on lots of different topics that are really driven by community. We also asked, how many years have you worked as an Indigenous health and wellness researcher? And you can see that at the lower end, we had a few researchers who are newer to the field of research and have worked for 2 years, up to a maximum of 46 years. So we had a pretty big range with a median of about 10 years working on Indigenous health and wellness research. We were also curious about where these researchers were doing their research. So as you'll see, nearly half said rural or reservation communities. About a quarter reported working with urban or suburban communities, and then about a quarter said other. So when we conducted this study, this was an online study. We use a software called Group Wisdom, which is how you can conduct a group concept mapping study. And the first phase, again, is called idea generation. So we asked all of the Indigenous researchers to complete this statement that you see here on the screen. Indigenous strengths-based health and wellness research. And then you'll see this line. And we asked them to think of as many ideas as they could think of that complete that statement. So they came up with 218 unique responses. We, as a research team, reduced that statement set to 94. What we mean by that is if there were responses that were pretty much the same, we combined them. We also took out irrelevant statements that didn't seem to respond to the prompt. So that left us at the end of phase 1 with 94 final statements based on what researchers thought of Indigenous health and wellness research. So the second phase of this project was data organizing. So what we do is we go back to the Indigenous researchers and we give them those 94 statements from phase 1. And we say, sort or categorize these statements in groups that make sense to you. So each person puts the different statements together, and then they also rate the importance of each of those statements. And then in phase 3, interpretation, this is where you invite participants to come back and help you interpret the data. So this is where you can see this process is constantly going back and forth between the research team and the participants. So we held 2 virtual meetings to share the results and share interpretations of the different cluster maps that came from our analysis. And we also had all of the participants help us name the clusters so that it really came from them in terms of what do these categories mean and how do they name them. So we found from the full project that there were 6 main clusters of these statements or categories. And again, these 6 clusters were named by the participants. I'm not going to go through all of them, but I will share. The first cluster is called Decolonial Research Exists, Resists, Persists in the Face of Colonialism. And when we talked about and looked at the statements under this cluster, our participants really talked about how strengths-based health research by and for Indigenous communities exists, resists, and persists despite ongoing colonialism displayed by Western institutions like academia. Indigenous researchers are often faced with navigating Western structures in the pursuit of conducting their strengths-based research. And though these Western structures, like things like funding, can intersect with Indigenous-led research, Indigenous health research is not defined by or confined to these structures. So we had really collaborative discussions about each of these clusters and the statements that came within these clusters. And just to give you a closer look at the clusters and the specific statements that fell under a cluster, you'll see that this is cluster 6, which was named Centering Indigenous Ways and Cultures in Research. So again, each of these statements responds to the prompt Indigenous strengths-based health and wellness research should feel like ceremony, should be driven by the heart, etc., etc. So these all came from the participants' statements. So we also wanted to take these 6 categories or clusters and talk about how do we create action around this. You know, we have this framework, we have these 6 categories about Indigenous strengths-based health and wellness research, but what does that actually mean? How can we propel action around this? So we developed some actionable recommendations that align with each category. I won't read through all the recommendations, but I just want to highlight a few recommendations because they have important implications not only for Indigenous health research, but for all research. So for example, one recommendation is funding agencies and institutions should support strengths-based health research. So it's really common when you see a request for proposals or a funding agency put out a call for grants that often the topics say you have to measure substance use, you have to measure risk, you have to have specific measures that are really, again, deficit-based. So this recommendation is really focused on flipping that and saying, you know, how do we support strengths-based health research topics in terms of providing funding and proposals that really support that. We also talk about, as a recommendation, research should lead to action. So research shouldn't just be published, it shouldn't just live in an academic journal. Research should really be focused on action, whether that's narrative shifting, advocacy, services, policy work, capacity building. So again, these are all recommendations that may benefit all research and community teams, not just Indigenous communities. And this is our published article. It's available to the public and it's open access, so anyone can read it, and especially in more detail. I just hit some of the highlights, but there's much more detail about the process of the study as well as what we found. And so the second example I want to talk about is an ongoing research project that I've been leading with another group of amazing Indigenous researchers and community members to develop a survey measure about Indigenous intergenerational connectedness. So as I mentioned before, many of us as Indigenous scholars and many of our communities are calling for more strengths-based work. That includes measures that we can use in our surveys, that can be used to evaluate programs, that could be used in research studies. I did a webinar, I think it was about 5 years ago, with diverse tribal community members attending. And I remember one of them asking in the Q&A section, so are you all going to create more strengths-based measures that we can use in our communities? And that just really stuck with me, that there is this call, there is this want to have more survey measures that really reflect who we are, as well as our ways of knowing and being. So intergenerational connectedness encompasses cultural values and beliefs that were part of a continuous history. So many of our communities have values around connection across generations, that we have deep connections to past ancestors and future generations. And you see this work in many of our communities all the time, thinking about past ancestors and future generations. And so when we think about this work in the context of public health, or health research, or program development by communities, a lot of this work can strengthen identity, it can promote health and wellness, and it can also prevent mental health and behavioral health inequities. But there have not been any specific measurement tools to really understand, okay, is there a way that we can measure connection across generations? So we have an ongoing study, a mixed method study that really uses community-based participatory research to develop an Indigenous intergenerational connectedness measure. So I'm going to share just a little bit about the first aim of our project, which the goal was to really just characterize and identify components of intergenerational connectedness using qualitative research methods. We have also completed aim 2, which is creating measure items collaboratively based on that qualitative research. And we are in the process of pursuing a larger validation study of the measure. So that's some future work that we'll be doing. In terms of our community-based approach to this study, we have 2 different groups who have been really key in guiding this work. We put together an Indigenous Measurement Development Group, or IMDG, we're calling for short. This is a group of 6 Native researchers with experience in Indigenous measurement development, as well as connectedness research. And they have helped us with planning data collection, even conducting some of the interviews that we did, and interpreting qualitative results. And then we also had a national community advisory board with 4 members representing 5 tribal nations. And they have also helped guide the study in numerous ways in terms of informing data collection, interpreting our findings, and again, how do we move what we've learned into creating this survey measure. So we, in terms of this first qualitative phase, we held 23 in-depth interviews to characterize and understand intergenerational connectedness. So we had 23 interviews with 21 individuals. They ranged in age from 25 to 77 years old. Most of our participants were female, about 67%, 24% were male, and 9% were Two-Spirit. And participants represented a total of 24 tribal nations and First Nations. So in terms of our analysis, what we found is three major themes in terms of how do we understand connection across generations. So the first theme is dimensions of intergenerational connectedness. The second is facilitators of intergenerational connectedness. And then third is qualities and outcomes. I'm going to talk about each of these on the following slides, what they mean and some examples. So in terms of dimensions of intergenerational connectedness, each participant described the relationships that comprise their sense of feeling connected across generations. They often did this by sharing stories about connection to their ancestors, to elders, to grandparents, aunts, uncles, parents, cousins, athletic coaches, teachers, friends, siblings, and children. And this is just one example of one participant who spoke about connection to future generations. And she said, I feel a connection with the younger generation, with unborn, to know that in taking care of this cultural and traditional knowledge, I'm also then helping to make sure that it's able to be passed on and that it's part of that continued cycle. In terms of facilitators, that second theme that we found that participants often discussed values, traditions, and activities that are facilitators that can strengthen intergenerational connectedness. So we called this theme facilitators, things that strengthen connection across generation. One of those examples that came up is land. So this participant said, I think the land is a big part of how I feel connected to my ancestors. Going back home to their reservation, there's just a deeper sense of connection there. I guess because I know that my family's lived there and that generations before have lived there in that spot. And then when I do things like harvesting wild rice or trying to make maple syrup, I know that those are things that have been done for generations and generations and feel connected to them in that way. And then the third theme is qualities and outcomes. So when we talk to participants, they often described when you feel connected across generations, this serves a lot of purposes and it can positively influence well-being. So this is one quote from a participant about identity specifically. And the participant said, but for me, it's just about remembering who you are, where you come from, and living it and sharing it with your family. And we're giving it to those around us, and especially our youth, our kids. And likewise, because we're radiating that energy, that knowledge, and that being of who we are. So that's what intergenerational connectedness means to me. It's just being us and remembering who we are, not getting away from it and keeping it close to our hearts and living it. So one of the key takeaways that we found from all of this work through these interviews, through this qualitative research, is that intergenerational connectedness really involves past, present, and future generations, and also the interactions between them, that this is very circular, and also that intergenerational connectedness is a multidimensional construct and has deep, deep importance across our communities. So this is our published paper. This is also available for free. It's open access, so anyone can read it if you want to read more about the qualitative research process to really understanding intergenerational connectedness across many of our communities. We also have a website on our Johns Hopkins Center for Indigenous Health website specific to this project, and we have some community dissemination materials. So we wanted to be able to share what we're finding, as well as share the measure when it's ready and finalized back with community and back with researchers. So if you go to our website, this is a one-pager that really breaks down what we found. We also have a two-pager that has a little more detail. And then down here, this is an 8-page brief report. So a little bit more detail for folks who want to learn more. In terms of where this project is going, as I mentioned, this is still ongoing work. So we have an initial Indigenous intergenerational connectedness measure that we've developed. We plan to share the measure through another academic manuscript, and then again, we'll put the measure on our webpage so it's publicly available for communities and researchers to use. We also have 2 research studies that are using a part of the measure with youth and adults from 2 different communities. So we want to look at that data in particular and see whether this is useful, whether it performed well in those studies. And then in the future, we're currently looking for some funding to do a much larger validation study to look at this measure and see really how relevant it is, both to communities here on Turtle Island, but also globally. So we're hoping to do a much larger study in the future with the measure. So just a few conclusions. Indigenous strengths-based research must be shaped by our Indigenous voices and our communities. We really need strengths-based research and measures that reflect our worldviews, our values, and our cultures. And there's this ongoing and growing movement that makes me really excited that will continue to indigenize strengths-based research. And I really see that shift and that movement because we're seeing more communities and Indigenous scholars working together to increase this movement. And I have some references here. I also have some acknowledgements. I want to acknowledge the whole Johns Hopkins Center for Indigenous Health that I have the pleasure of working with, but specifically some collaborators on the 2 projects I mentioned today. Our amazing Community Advisory Board and Indigenous Measurement Development Group members, as well as all the community members who have really honored us with their time and knowledge to these projects. So Wado, and I'm happy to answer questions and chat with folks.
Awesome. Thank you so much, Dr. O'Keefe, for that wonderful presentation. I see all the applause coming through. And also just quickly looking at the last chat, I see that somebody had mentioned that they had cited some of your work, so they were really excited to be able to watch your presentation. I wasn't able to scan all the chat, but Trudy, did you see any questions? Also opening it for anybody out there who might have some questions right now.
No, I didn't see any questions, but I just had one quick question in regards to the map of the John Hopkins sites. I know that Alaska didn't have a site. Is that something that is that will possibly have a site? Because I know that Alaska has a huge native presence.
And so I believe we have some projects and programs with Alaska Native communities and some collaborations, but we don't have an office necessarily. I think typically how some of our, especially some of our two newest offices are our Great Lakes Hub in Duluth, Minnesota, as well as our Great Plains Hub in Rapid City, South Dakota. What has happened is because some of our research and community partners have been really strengthened in those areas, that has led to the founding and sort of formation of place-based work. So it's always a possibility. I think we always talk about the center as continuing to expand our partnerships and grow more offices. I think it's a really unique way of working too, because it gets away from this helicopter mode of research. We should be in and with our communities. I'm doing more and more work with my nation, Cherokee Nation in Oklahoma, as well as other tribes in Oklahoma. So we're even talking about an Oklahoma hub and what would that look like. So it's definitely a possibility and would be amazing if collaborations continue to strengthen in Alaska as well.
Thank you. I don't see any questions. Everyone is just applauding you over for your hard work and
Oh,
appreciate and value your great presentation.
All right, I do see just a question about the presentation. Will you share your presentation?
yeah,
I think.
absolutely. I'm happy to share my slides. Also encourage everyone to follow our Center for Indigenous Health on social media. We have Facebook, we have Instagram, we may have TikTok, I'm not sure. But we have lots of social media channels, so follow our work, follow along with us, and if anyone wants to connect more, I'm happy to chat more with folks, and just really grateful for all the positive comments and everyone who's here today.
All right. I also did drop our playlist, our YouTube playlist for all of our Indigenous Health Topic webinars. So they are recorded. You can find all of the past and most current webinars located there. And also, I am going to include a link in the chat as well for a quick survey just to provide any feedback on how we are doing and any future presentations if there are recommendations. But I do see, looks like we have another question. So in the Q&A from Paulette, have you worked with private businesses to design studies involving Indigenous communities and participants?
I'm wondering, Paulette, can you say more about private businesses? I can share we typically partner directly with communities. Oh, biotech companies. I believe some of our teams have collaborated with I don't necessarily think biotech companies, but we are doing some more work on machine learning, on AI, but typically that's really in collaboration with Indian Health Service or tribal health systems. I don't think we've specifically worked with private businesses, but I could be wrong. Thanks for your question.
I do see another question. It says, how do you recommend approaching Indigenous communities with regards to quality improvement versus research? How do you frame your work so the difference is understood?
Yeah, that's a great question. I think that's very unique in the work that we do at the Center for Indigenous Health is I think what we would call public health practice is probably similar to what you mean quality improvement, but we have different public health projects that are really resources for the community that don't include research or evaluation. We also have instances, again, we have so many teams, so there's lots of examples, but we also have some teams that we do have tribes or even healthcare facilities that may reach out to us and say, we need help on evaluating a particular program that we're trying to run. Can your center help us with that? So I think it's just being very clear in the communication. Is the intent research? Of course, if it is research, there's lots of both tribal approvals. It could be an institutional review board approval, or it could be Indian Health Service approval. Sometimes it's both of those levels of approvals. So I think you have to be very clear about what is the goal of your project. What are the priorities of that community partner? And then also what are the steps that, you know, in terms of things like Indigenous data sovereignty and tribal sovereignty, making sure that you're following protocols with that particular community or tribe.
Okay, so there was just another question that popped up is, what part of doing your studies did you find most surprising or enlightening?
Oh, I love that question. Let's see. I think there are these ways that I think it's the process of the research. So for example, in the group concept mapping study with other Indigenous researchers across the country, some of whom I've met in various spaces, some who I've never met, but I'm a fan of, and it was very cool to invite them. I remember, you know, we sent some of the first emails about the project, and everyone was just so excited and said, this is amazing. This is so cool. Yes, I want to be a part. And I think through that process, all the way through the data interpretation and publishing this paper together, I just think we heard so many positive comments about, we need more work like this. Thank you so much for doing this. How can we continue this work together? I just think there's so much collective power that came from that project and other projects that, you know, sometimes in institutions we might be just a few people or very isolated. And it's those projects that we all come together and really put our heart into it that I think really shows the power of what we can do together. So I would say that's some of the most enlightening and powerful aspects.
All right. I do see, okay, so I don't think this question is for you. Sorry, CEUs are not available for these presentations. All right. Well, thank you, Dr. O'Keefe. I think that covers all the questions we have, but that was a really amazing presentation. We're really looking forward to having you. So happy that you were able to join us today, and hopefully we'll have you again in the future. We are working on our lineup of presenters for the next year. Our next Indigenous Health Topics conversation will be October 31st, I believe. So on Halloween. Still can't believe we're pretty much done with the year, coming into a new year already. But thank you everyone for joining us this afternoon. I hope you have a wonderful rest of your Friday and also your weekend.
Lindo, thanks so much, everyone.
Thank you.